She allegedly needed a half gallon of fillers taken out and a facelift at 34 years of age. We're gonna break this down full throttle. Hey Doc audience, fillers can be very effective, but there are also some dangers of fillers. This is a crazy story. Rod, a young woman, apparently had all this filler that she had put in her face and they had to remove it, and then she had to have a facelift at 34 years of age. It's not crystal clear exactly what the details are, but the concept is a good one. So
right.
What are some of the dangers of the fillers and what have you seen?
Well, I mean, it's the national saga of, fillers, now excess fillers, and now we're going back to little to no fillers. And so the bottom line is know before you go and find an injector that's not going to overfill you. It's not surprising. Apparently she had fillers for a long time, and then at age 34, they had a 9-hour operation to remove like a lot of fillers. Well, that doesn't quite make a lot of sense because hyaluronic acid fillers should be melted before, a few weeks before, and I don't know what kind of fillers she had, but in looking at her photos, she does look better. But this is just an ongoing saga that we have in America too, because of the fact that people don't know when to say no. And the injectors, the physicians should say no. And also the people, you don't want to, we're in the face protection, not witness protection program. And these people look like pillow face. I mean, look at those photos of Madonna and all of those other famous actors and actresses that, you don't recognize them until they sing. And so it's really not a good thing. But I think the lessons here are, don't do excessive fillers. If it looks weird, it's going to be weird. And the other thing is, fillers are not necessarily resorbable. That's kind of a myth, because if you put so much fillers in, you get fibrosis, and you've seen that, Bill, in the face, and you can't melt it. So too much filler, wrong fillers, put in the wrong places, injectors not knowing when to say no. And then when you do melt them, it's like pregnancy, or weight loss. Guess what? You get contraction and you get sagging, you get facial aging. And what does that mean? You have excess skin. Usually when I see a patient that's got excess filling, I melt as much filler as I can, and then I will do a facelift on them and take out all of the foreign body material that you can. You can't get it all out. And then you reshape them. And it's kind of a norm today, unfortunately, that people have had fillers and haven't told you about it. And so, but this is an extreme case. And I think that the lesson here is, find a person that's going to be honest with you and not overdo you, and just do it incrementally. And fillers are not totally resorbable.
And do you think that, you mentioned, the hyaluronic acid fillers you can dissolve and melt away, but there's also some legitimate fillers that you can't really dissolve. So what do you think about those? And do you recommend people that are doing fillers use certain ones?
That's a great question, because there's the new biostimulator fillers, Sculptra and Radius, and they take 2 years to resolve. You can't melt them away. And so I think that there's the hyaluronic acid fillers, there are biostimulators. Now there's going to be the natural fillers, the platelet-rich plasma, the platelet-rich fibrin. Those are going to be the ones I think that are going to be better, because they're going to have your own body stimulate the regenerative matrix of what you should look like and should stay. So, but the next generation of fillers will be the ones that actually will make your own fat and actually stimulate your whole matrix, so that actually you'll look young long term and not have all these crazy side effects.
That is great information on out of control fillers, how to stay safe. If you like that, check out this video on an out of the control preteen, looking at the consequences of viral TikTok skincare regimens.